Good morning.
Good morning.
We're here with Dr. Johnson, our favorite Dr. Johnson. You were just saying that this was like the show of the two most eligible, handsome men on earth. I have not seen anybody better looking than you and I.
I didn't say that you were eligible.
Oh, you said...
I'm the only one.
I submit to that. So thank you. Welcome to Conversations with Dr. Johnson. Today we continue our conversations on gut health with specific implications on cardiometabolic health.
Okay.
Dr. Johnson, welcome.
Thank you.
So yesterday, give us, you talked a lot yesterday about gut health and some of the key things that we need to be doing to maintain healthy gut. So can you just give us a short summary about that? We had some supplements we spoke about and we have them here today.
Yeah.
Go ahead.
Well, gut health is critically important. It's certainly an important part of the foundation upon which the rest of our health stands. So we've got to start with eating a healthy diet.
Yes.
Then we have to have adequate digestive enzymes.
Yes.
Okay. Then we have to have an adequate amount of friendly bacteria, or probiotics as they're commonly called.
And these probiotics feed on fiber. So
they feed on fiber.
Yes, and so if you eat fiber, you're going to maintain that healthy diversity of good and bad.
That's certainly going to help a lot.
So
yes.
what happens to the good ones? They get killed by the bad bacteria, or what happens?
Well, they basically get crowded out.
Okay, so the bad ones grow faster, and then the good ones are overwhelmed.
Yeah, they're all supposed to exist in harmony.
Yeah.
It's not possible to completely get rid of bad bacteria in our gut, nor would that even be desirable.
Yeah, so it's good to have bad bacteria, but not overwhelming.
Yes, just in small amounts.
All right, and then the good bacteria. But it tends to be that as we push with this probiotic agenda, you need probiotic, which is the good bacteria. You have to take that daily to create that right balance.
Yes.
Could you have too much of good bacteria?
I've never heard of such a thing happening.
Okay.
And
any of you who think you might overdose on probiotics, your probiotics is good for you.
Yeah. And unfortunately, in our modern world, people take antibiotics at the drop of a hat. Doctors prescribe them at the drop of a hat.
Yes.
And most of the antibiotics tend to kill off the good bacteria and not have that much effect on the bad bacteria.
Yeah, those bad boys are resistant to the antibiotics.
In many cases, yes.
Yeah, they are like, what was that? Psh, we don't care, we ignore it. All right, so today we wanted to look at how gut health affects some of the underlying issues that in collective we call cardiometabolic health. So the first one is obesity.
Okay.
What are the obesity issues that generate with gut health?
Okay. So when you have excessive bad bacteria, not enough of the good guys, what tends to happen is you have less of something called butyrate in your system, because the good bacteria produce butyrate. Butyrate is a very important energy source for the human body in general.
And this is a fatty acid, right?
Yes.
Is it produced in the body, or it's produced by the bacteria in the body, or where does butyrate come from?
It's produced only by the good bacteria in our intestine.
Okay.
And so if we have an overgrowth of bad bacteria, not enough good, then we don't produce much butyrate. And it's a prime energy source for our mitochondria, the power plants of all of our cells. So if you don't have enough butyrate, you tend to have lower energy, and then people with lower energy are much more likely to gain weight.
Oh, wow. So it's really important how we go from probiotics to butyrate,
yes,
and to weight gain and obesity.
Yes.
So the second part is also issues of inflammation, and how does gut health affect inflammation, and how does inflammation lead to these cardiometabolic issues?
Back to butyrate, it has a powerful anti-inflammatory benefit.
Okay.
So we need to have enough of that.
Yeah.
And the other part is poor diet and gut health can lead to leaky gut syndrome, which we talked about yesterday.
Yeah.
And with leaky gut, you get incompletely digested food particles that pass directly into your bloodstream.
Yes.
That tends to trigger an allergic reaction, which is a type of inflammatory reaction.
Okay. So inflammation, as we know, it's a real challenge. And inflammation is triggered, as you said,
Yes.
by issues of leaky gut. So how do we then get to issues like fatty liver disease, non-alcoholic fatty liver disease, and what are the implications of non-alcoholic fatty liver disease with gut health and cardiometabolic?
Well, the implications are that your liver doesn't function very efficiently. And normally, one of its most important functions, which is detoxification, then doesn't work properly.
So that is if you don't have good gut health or if you have fat accumulating in your liver?
Well, if you have fat accumulating in your liver, and being overweight in many cases is a result of poor gut health.
All right. And so then fat accumulates around your liver.
Yes.
And that begins the non-alcoholic fatty liver issue.
Yes.
That is called NASH, right?
Yes, yes.
And NASH then could become more complicated. Most Americans have that problem.
Well,
in a country where most people are obese.
Certainly most overweight Americans have that problem to some degree.
All right. So, I mean, if you're overweight, there's a tendency that
Yes.
you might have non-alcoholic fatty liver
Yes,
disease.
exactly.
And at the source of that is really your gut health.
Yes,
Again, going below that, it's really the bacterial diversity.
yes.
Interesting. Okay, so then let's talk about things like diabetes and how that is tied to also our gut health.
Okay. So when people gain weight,
Yeah.
they almost always develop a condition called insulin resistance.
Okay.
Normally, when we eat our food, some of that is broken down into sugar. Sugar is certainly one of the things that our cells burn to create energy.
Yeah.
Okay. However, when people are gaining weight, the cells tend to become resistant to insulin, and as a response to that, your pancreas puts out more insulin.
Yeah.
Okay? And more insulin leads to more insulin resistance. And insulin resistance leads to prediabetes, which leads to full-blown
Ultimately, to
diabetes.
diabetes.
Yes.
And we're talking about type 2 diabetes?
Yes.
Because type 1 diabetes is a genetic issue, right? Where people have that insulin
Well,
problem.
there's probably a genetic component, but it seems to be more of an autoimmune disorder, where your body attacks the islet cells in your pancreas where the insulin is produced.
Oh, that's type 1 diabetes.
Yes, yes.
And you said it's beginning to emerge as if it is an autoimmune illness. Because historically we thought type 1 diabetes was like something you were born with. And so you're saying that
No.
there's new research that indicates that?
Yeah, type 1 diabetes usually develops in childhood.
Yes.
And it's common that it develops after an acute severe viral infection, such as mumps or measles.
Yes.
Okay.
This is new knowledge to me.
Okay, well,
Very interesting.
I'm happy to enlighten you.
So do adults have type 1 diabetes too?
Well, look, type 1 diabetes causes severe health issues. And so type 1 diabetics, if they don't really stay completely on top of this,
Will not get to adulthood.
well, they'll get to adulthood, but they'll die in young adulthood.
Really?
A few years ago, I had a type 1 diabetic in my practice. He was about 30 years old, the nicest guy you'd ever meet. However, he would never follow my recommendations. And sadly, and not surprisingly, he passed away a few years ago from his complications of type 1 diabetes. So he had not reached the age of 40 yet.
Wow.
Yeah,
Those are serious things.
it is.
I didn't know type 1 was that dangerous. And type 2 in itself is really, really dangerous. Diabetes is a very dangerous.
Yeah,
Go ahead.
I would call type 1 much more dangerous than type 2.
Yeah.
However, type 2 is much more common. Type 2 diabetes is a lifestyle disease. It's a disease of not enough activity, and it's a disease of eating the wrong stuff. The standard American diet triggers weight gain in the vast majority of people, and that leads to insulin resistance, to prediabetes, and then on to full-blown diabetes.
But then, the other thing that we never talk about, are the end-stage complications of type 2 diabetes?
Well, the end-stage complications are things like strokes,
Yes.
heart attacks, blindness, kidney failure, amputated toes and feet. And what is the common thread among all of those? The common thread is hardening and clogging of the arteries.
I was going to go there,
Yes.
Hardening and clogging of the arteries.
Yes, because diabetes, all of us have a tendency towards hardening and clogging of the arteries as we age, but diabetes dramatically accelerates that.
Oh, that's very interesting. So now we started with gut health, but
Yes.
we are like into all these other things
Yes.
that Western medicine is built around to solve, which they're not solving.
No, Western medicine is built around managing the symptoms, not getting to the true underlying cause in most cases.
And so what would be the true underlying cause when somebody has all these comorbidities? They have loss of eyesight, they have neuropathy, they have all these issues.
Look,
Kidney disease.
yeah, when it comes to hardening and clogging of the arteries, there are at least 15 different risk factors that can lead to that.
Yes.
And so that's looking at it in kind of microscopic detail.
Yeah.
If we want to look at it in more general terms, the big things that cause most medical problems are stress,
Yes.
present or past, because that leads your adrenals to put out excessive cortisol.
And that's the one that money cannot fix, right? Stress.
Well, if you have the right counselor and learn stress management, it can solve it.
I thought you were going to say if you have the right lawyer and banker. So
No.
are you saying that if I have $1 billion, I'm going to still have stress?
Well, I suspect most billionaires probably have more stress
But
because
they have counselors.
there are certain problems that result from having not enough money.
It's
But
like
there-
people like me wanting to take their money.
But there's a whole new list of problems that come with having a lot of money.
So who is more stressed, poor people or rich people?
It depends on the individual. It depends on
I
the
thought you were
individual.
going to say poor people, but I think poor
Well,
people
there's
have
certainly
more stress.
more poor people than there are billionaires.
Yes,
Certainly a lot more.
And our data is mostly with the poor people. They have more stress because they have to worry about basic things.
Sure.
Yes. And so you spoke about stress. What else?
As far as what causes hardening and clogging of the arteries?
Yes.
Okay, so we have things like diabetes,
Yes.
obesity,
Yes.
high blood pressure, smoking, cholesterol, triglycerides.
Alcohol. You were hesitating on that because you drink a bit, right?
Excessive alcohol.
Excessive. Okay.
But that's not on our primary list.
Okay.
That's not on
So
our
secondary list.
Yeah. Homocysteine, inflammation in the walls of arteries, high LP little a. There are things like nitric oxide deficiency,
So I'm
magnesium
overwhelmed when I
deficiency.
hear all these things. It's like I should just die.
No, not at all. When patients come to me, I
Yeah.
consider that I have two jobs.
Yeah.
One is to address the problems they present to me.
Yes.
And then the other is to recognize that all human beings have some ticking time bombs internally
Yes.
that, if not diffused, will eventually lead to some catastrophic health consequence.
Rather than a death where you just lie in your bed and die quietly. If
So,
not, you will die with people trying to bring you back. Right.
yeah, clear.
Clear. 200 joules clear.
Yeah.
Right.
Yeah, so my job is to identify those ticking time bombs
Yeah.
and show them how to diffuse those time bombs,
All right.
which is usually with diet, exercise, certain supplements.
Okay.
Yeah.
So gut health is at the core of
Yes.
all these other complications.
Yes.
Yes. And so we need to focus on that and making sure that we're eating the right diet, because every time you say the right diet, people roll their eyes like, what is the right diet? So, Dr. Johnson, you are a healthy doctor.
Thank you.
What is your diet?
Okay, so everybody knows, I believe, that when we eat our food, our calories come from three sources, okay? Protein, carbohydrates, fats. So protein is very simple. We should have some protein at every meal, 2 or 3 ounces only. That's a very small amount of protein.
That's like 2 eggs.
Yes, and it'd be somewhere between half a deck of cards to a full deck of cards in size.
Okay.
Whether that is beef, whether that is poultry, whether that's fish, whether it's eggs, whether it's beans, poultry, nuts.
So you don't go crazy with some Korean barbecue just eating meat.
No, no, no.
All right.
Just a modest amount.
Modest amount. Yeah. Okay, that was protein.
And it's amazing. Some people eat hardly any protein, which is very bad for us.
Yes.
A lot of Americans eat way too much protein. They go to the steakhouse and order the 24-ounce porterhouse. My gosh, that should be 6 to 8 meals worth of protein right
and
there.
You eat in one meal.
Yeah.
So that's protein.
Yeah.
And
Carbohydrates. There are good carbs and there are bad carbs.
but you said something amazing the other day about resistant starch. That if you boil rice and keep in the fridge
Overnight.
the next day it's resistant starch.
Well, not 100%, but more of
we
it.
get there because already Karen was already freezing most of her rice.
Yeah, and that's true of potatoes.
Yeah.
That's true of pasta.
And why resistant starch?
Well, resistant starch means that your body doesn't digest it and break it down as it normally does with carbs.
Okay.
And so the resistant starch passes through your digestive tract, and when it gets to your colon, the friendly bacteria feed off of the resistant starch. In other words, it acts like fiber.
Okay.
And more fiber is almost always a good thing. Now, please don't anybody go from eating 10 grams of fiber a day to eating 75 grams of fiber a day, because your gut will not be healthy with that. It needs to ease into that transition gradually.
Wonderful.
Okay.
And then that was carbohydrates, then fats?
Fats, okay. There are good fats and bad fats, okay? And how do we tell which is which? Well, the good fats are the ones that come to us directly from nature with little or no processing.
Like pigs, like pork?
No, I don't eat pork. I don't believe that pork is fit for human consumption.
Oh, wow, that's deep thinking there. And why is that?
That's very complicated, and I don't think we have, I think it's beyond the scope
I
of
know
today.
it comes from your history and things like that.
Yeah.
Well, part of my family was Muslim, and they don't eat pork because they think the pork eats all kind of crap. So what kind of fats then do you eat?
Okay,
And what are the sources of that?
okay. I eat organic extra virgin coconut oil.
How do you know it's extra virgin?
The label says so.
All right. I thought that they were harvested from virgins.
Hilarious.
They squeezed virgins and got the coconut oil out.
Yeah, I could make a comment here, but I'm going to resist.
I know. I was trying to tease that out
Yeah.
of you.
Yeah. We get healthy fat from organic grass-fed beef.
Okay.
We get healthy fat from fish. We get healthy fat from egg yolks.
What about things like ghee and...
Well, as long as that ghee is made from organic grass-fed butter.
butter? Okay.
Yes.
All right. Very interesting.
Yeah, but organic grass-fed butter is actually a very healthy fat. Now, all of us have been told that we should stay away from saturated fats. And if we're eating the right saturated fats, not only are they healthy for us, they're actually essential. 50% of our fat intake, and this is very different from advice you'll hear among mainstream dietitians, but 50% of our fat intake should come from healthy saturated fats.
Wonderful. So, do you take probiotics
Yes, of course.
every day or every meal?
I can't honestly say I take it every day, but I frequently take it.
Do you take digestive enzymes?
Again, I can't say that I take it every day, but,
I take
but
them
frequently.
religiously.
Yeah.
And what about fiber intake, Doc?
I get as much fiber as I can.
And what's your main source of fiber?
Well, fresh fruits and vegetables
Okay.
are an important source. Acacia fiber is one of the best sources of fiber on
And
the
what's
planet.
acacia? I don't know what that is.
Acacia is an African tree. Now, I cannot believe that you don't know what acacia
But
is.
we don't eat that tree.
You should chew on the bark
Oh, we use that as a brushing to brush the teeth.
because of the fiber.
Yeah, and it cleans the teeth. Okay,
Okay.
but I was talking about eating. I didn't know. Like we use acacia. I know that. Yes.
Yes, I
We
believe.
use that for brushing the teeth, and then we use the fiber. Here.
Yeah, this, if I recall correctly, this particular product has acacia fiber in it as the primary ingredient.
Yes, that's
Yeah.
a tribe. That's a,
Yeah.
a prebiotic.
Yes.
Or the fiber product.
Yeah, so all fibers are, well, most fibers are prebiotics to some extent.
Yes.
And the soluble fibers, as opposed to the insoluble, the soluble fibers are much stronger as a prebiotic.
A lot of people, a lot of our patients, when they begin and they start with the pre and the probiotics, tend to have like running stomach or dysentery and tend to stop because they think that's a bad thing. Is that something you've encountered in
Well,
practice?
those people need to back off and then gradually go back to it more gradually,
All right.
because the gut is a creature of habit.
Yeah.
If you're eating a horrible diet with very little fiber, that's what your gut is used to. And if you make a sudden change, it's not going to be happy.
Okay.
Just as the couch potato shouldn't go to the gym and try to bench press 200 pounds on his first day.
And have a problem
It's
with
going to
that.
be a shock to the system, or he's going to drop the bar and break his neck.
Exactly.
Yeah.
Well, as usual, Dr. Johnson, thank you
You're
for
welcome.
a very interesting conversation about gut health and cardiometabolic impact.
My pleasure.
So thank you for joining us. Tomorrow we'll have another session with Dr. Johnson on gut health, and we'll be looking at other implications in terms of neurological issues and how that's connected to our gut, especially leaky gut. Thank you. We discovered some jewels today with some of the things you said about type 1 diabetes and how dangerous that was. So guys, stay healthy. Thank you again, Dr. Johnson.
My
And
pleasure.
Thank you for joining us. Like us, love us, don't hate us. And send your questions and comments, and we'll answer them online when we're next on. Thank you for joining us. Thank you, Dr. Johnson.
All right, my pleasure. Thank you.